Okay, so Dr. Mead, if we could just first start with Lyme as it is recognized by the CDC. Explain to me the agency's view on Lyme, or its position on Lyme.
Well, I think you're asking about the causes of Lyme disease, and Lyme disease is caused by a spirochete, one of several different types of spirochetes that fall under the general name Borrelia burgdorferi. It's transmitted by ticks, and it can produce a wide variety of different clinical symptoms. Typically, people with early stages of disease get a rash along with fevers and muscle aches and pains. If not treated in that early phase, the spirochete can disseminate and spread to other parts of the body, causing a wide variety of other symptoms.
A wide variety of other symptoms that, from my understanding, can also mimic a lot of other diseases. Is that why it's often referred to as the great imitator?
Well, actually, the great imitator is a term used to refer to syphilis, which is a different disease, but it certainly can produce a variety of different clinical features. One of the more common ones is Bell's palsy, which is a partial facial paralysis. In later stages of disease, it can produce arthritis, particularly of the large joints and the knees, which can be long-lasting or relapsing.
So let's talk about how do you determine if somebody has Lyme. So you said we know that it's transmitted by way of a tick. And my understanding is that actually the vast majority of people don't even remember getting that tick bite. So whether or not they got the rash, I guess would depend on whether or not they remember being bit by a tick. How do you determine if somebody has Lyme?
Well, first off, you're correct that the ticks that transmit this disease are quite small, particularly the nymphal ticks, and so many people will not be aware of having a tick bite. They may still recognize the rash, which typically develops a few days to weeks after the tick bite. In terms of diagnosis, there are really two parts to diagnosis. There are the clinical features of the disease, that is what the physician can see, a large joint, a red rash, a fever, that sort of thing. And then there is laboratory testing. So the recommended way of diagnosing Lyme disease in the laboratory is by the use of serologic tests, primarily. And in general, we recommend a two-step process to this, where the blood is tested essentially in two steps to identify whether or not the person has evidence of infection with Borrelia burgdorferi.
So a physician needs to see something. Oh, sorry. So are we all there?
We're here.
Okay. Oh, I apologize. I thought maybe I dropped you.
Maybe someone else is here too.
To see something on the patient that is in keeping with the traits that are associated with Lyme, and then it's after that point that they can order the test.
Well, no, a physician can order the test, but at any time, but it's most valuable to order the test in people who have who are likely to have the disease. If a person is unlikely to have the disease and you order the test, there's a chance that if the test comes back positive, it's more likely a false positive than a true positive. So it can be a little bit misleading in that setting.
Don't forget to look at me. And the tests that are recognized by the CDC, the tests that are essentially, they get the CDC's sort of stamp of approval. Tell me about that, not only the Western blot, but my understanding is that that's also a two-step process. Is that right? Right.
The two-step process I'm talking about is serologic testing, which looks for antibodies to the bacterium. And it involves first a test called an EIA or an ELISA, which sort of generally looks for antibodies to it. And if that test is positive or equivocal, then we recommend a second test, the Western blot that you mentioned, which provides a bit more certainty to that test. So that is the recommended serologic way of testing for Lyme disease. In general, CDC recommends that people rely on FDA-approved tests for the diagnosis of Lyme disease.
And just state what those tests are, the FDA-approved tests.
Well, the FDA-approved tests are various forms of the two-tier assay that I just mentioned, the serologic antibody testing.
So many of the patients that we've spoken to, and by no means, doctor, am I an expert in this, but I'm attempting to learn as I go, talk to a wide variety of different patients. And the vast majority of patients that I've spoken to tell me that each and every time that they were tested for Lyme, whether it was something that was brought up in the very beginning because they had a rash, or something that was mentioned years down the road because they had these persistent symptoms. The vast majority tell me that their test results came up negative, as you were saying. They're not always that reliable. Has that also been your experience, that these tests are not that reliable? I'm talking about the FDA-approved tests.
Well, a serologic test for Lyme disease, let me step back for just a second. So serologic testing is something that's done for a wide variety of infectious diseases, and it has a great number of strengths, but it has some limitations. And one of the key limitations of serologic testing, which I think is often misinterpreted, is that early in the course of infection, the test may be falsely negative. And this is because the test is not looking for the organism itself, it's looking for the body's response to it, the production of antibodies. And so there is a window period early in the course of infection, by which I mean in the first few weeks, when a patient may be infected and not yet test positive, not yet have enough antibodies. And this is not just true of Lyme disease. This applies to HIV or any number of other tests for which there is a serologic test. However, much later in the course of illness, or after a month or so, the test becomes much more reliable. And so if a patient has been ill for just a few days or weeks, the test may in fact be negative. If, however, a patient has been ill for months or years, if the test is negative, that's good evidence that in fact their illness may be caused by something other than Borrelia burgdorferi infection.
But just to piggyback off of what you just said, though, if these tests often in the very beginning do not, or not often, but if these tests in the very beginning sometimes don't show that the person has been infected with Lyme, and if that is the period of time where my understanding is they are most susceptible to positive results when it comes to the antibiotic treatment, then there seems to be a disconnect there. If the antibiotics work best early on, but the test doesn't prove that they have Lyme early on, then those two don't match up.
Right, and the recommendation for management of a patient who shows up with signs of early Lyme disease, for example, an erythema migrans rash, maybe they're aware of a tick bite, it's often in the summertime. The recommendation is actually to treat those patients then and there without necessarily ordering the test. And this reflects the fact that that the test can be falsely negative early in the course of illness. And so CDC's recommendation is, and others, is that those patients be treated if they have signs or symptoms of Lyme disease.
Dr. Talk to me, I know that it's not the CDC approved format, but talk to me about the IGAD Guidelines and why the CDC has determined that that's not tests and guidelines that they should recognize.
Well, I think the IGAD Guidelines, there are a lot of differences between the IGAD Guidelines and the guidelines put forth by the Infectious Disease Society of America. And I think it's easy to get bogged down in the details, but it really is fairly simple, and it boils down to this. The IGAD Guidelines advance two basic ideas. The first is that there really is not any adequate scientific information about the management of Lyme disease. And the second is that in the absence of that sort of information, healthcare providers should be free to do and treat patients in whatever way they see fit. Our concerns are that that misrepresents or does not give full credit to the amount of scientific evidence that there is about management of Lyme disease. And perhaps more importantly, we are concerned about patients who are being treated with unproven therapies, with therapies that are sometimes harmful. There are case reports of patients who have died as a result of long-term therapies for Lyme disease, when in fact there wasn't even necessarily evidence that they were infected. So we're very concerned about those patients, and we understand that patients who don't feel well are desperate and seeking answers, but we're concerned that some of them fall into a trap of being treated for things that ultimately are not helping them.
But my understanding is, and again, in speaking to some physicians who specifically do treat Lyme, and actually one who is an oncologist, Dr. Spector, who you may or may not have heard of, who's an oncologist. He doesn't deal with Lyme at all, but he has, in fact, he believes, been infected by Lyme, and it almost cost him his life. And from what I can understand and from what they are telling me, again, just from a layman's perspective, that there have also been studies that have shown that there are people who have been diagnosed with, say, MS, have eventually, over the course of their lifetime, passed away, whether or not it was from a complication of the illness or not. But when the autopsy on them was done, in particular studies, each of them had traces of Lyme in them. So it seems to me that while, yes, Lyme could be something other than Lyme, right, that the patient could be treated for Lyme when maybe they really do, in fact, have fibromyalgia or MS or something else, couldn't it also go the other way as well? Couldn't we perhaps be turning our back on the legitimacy of Lyme in this regard?
Yeah, well, I don't think we're trying to turn our backs on the legitimacy of Lyme as an important vector-borne disease, and we certainly want to emphasize that it's an important disease and have people treated for it. However, the reports of cases of Lyme being mistaken for other diseases are really quite rare, and sometimes a little bit difficult to know exactly what was happening in those cases. And I think that has to be counterbalanced with patients who have been told they have Lyme and been treated for Lyme, who in fact have other things, pituitary adenomas, other types of malignancy. And some of those patients were actually seriously harmed by being given a diagnosis and long-term therapy for Lyme disease, when in fact their underlying condition went untreated. And we're concerned about those patients as well.
It seems as though, well, actually, let me ask you, why do you think there is so much controversy here? Of all of the illnesses that are talked about, it really does seem as though Lyme is the hot button issue, and especially if you are somebody who has been diagnosed with it, you certainly have an opinion about it.
Yeah, it's hard for me to understand exactly. I mean, clearly it's a common disease. It makes a lot of people sick. And I think for that reason, it's obviously important. Why there seems to be so much controversy, I'm really not entirely clear. There is a lot of misinformation about Lyme disease, about basic facts about it, that are spread a great deal on the internet and other settings. And I fear that sometimes if people have heard something enough times, they come to really believe that it must be true, and that helps stoke some of this controversy. Certainly, there are things we need to learn more about Lyme disease, and as we do, I think that will help us brush away, or not brush away, but resolve some of this controversy, hopefully. I mean, there are fundamental questions about the cause of long-term symptoms in people who have been treated, and some questions about how best to diagnose and treat those patients. But I think, the way we address those is with good scientific evidence.
In talking to some of the patients that we've spoken to, they said the relief on their end came when they found a Lyme literate doctor. But they have also been told by others in the medical community that those people are nothing more than quacks who are going to take them on a ride financially, specifically because it is so expensive to go about on a Lyme treatment, especially if the insurance company won't cover it. From your point of view, not only as somebody at the CDC, but also as a physician, Lyme literate, is that a term that you recognize? And do you also see these people as quacks or charlatans?
Well, I'm certainly familiar with the term that some physicians are referred to as Lyme literate physicians. I don't think I'm in a position to weigh in on their particular practices or motives in this debate. I think we really need to focus on patients, which is getting, and that means getting patients good, solid, science-based information that they can use with their physician to help guide their care.
But in terms of the science and in terms of the studies, at the very least, it seems to me from just the research that I've done, that more studies are needed. That if anything needed to really be given a fresh set of eyes and you know, and a clean slate to really determine what is the proper course of treatment, what are the proper tests to administer, and sort of a fresh round of education for all in the medical community. It seems as though Lyme would certainly fit the bill. What is your take on that?
Well, I think you brought up several things there, but I think the in terms of treatment, you know, there have been a number of studies done that have looked at long courses of therapy. So in this setting, we're talking about patients who have been diagnosed with Lyme disease, have been treated for Lyme disease, but may have persistent symptoms, fatigue, some confusion, muscle aches and pains, sleep disturbances. So this is the group of patients which are sometimes referred to as having chronic Lyme disease, or probably more appropriately, post-treatment Lyme disease syndrome. So there's no question that these patients exist. The question is, what is the best treatment for them? Now, in fact, there have been a number of studies, including one just published recently in the New England Journal from the Netherlands, which have looked at longer courses of antibiotic therapy for these patients. And of course, what they find is that when patients get that therapy, they improve. The problem is that patients who got the placebo also improved at the same rate. So I think it's a little bit misleading to suggest that there has been no science done on this topic. Now, clearly, there are limitations to every study. There's more that we need to learn. And so I agree with your statement that more studies are always valuable. But I think we also can't just dismiss out of hand the numerous studies that have been done. And I think those should help guide physicians as they approach patients with these symptoms. And I think should help patients think a little bit about the risks and benefits of therapies that may be prescribed for them.
Yeah, and let's just touch on chronic Lyme, because that seems to be the most controversial of the entire lot, or at least I'm quickly learning. My understanding is that the CDC does not recognize chronic Lyme as one of its chronic diseases, the same way that it recognizes type 2 diabetes, obesity, arthritis, cancer, heart disease, and so on. Is that correct?
No, that's not correct. I think it's a little bit of a semantic issue. There is this term chronic Lyme disease, which is used, I think, in the public in general. And part of the problem with that term is that it is not terribly well defined, and it may include people who've had Lyme disease, but often it includes patients who actually may have other causes of their illness. So it's a very broad term. We certainly do recognize that there are patients who've had Lyme disease, who have been treated, and who will have persistent subjective symptoms, as I mentioned, fatigue, some difficulty with their sleep and with thinking, and muscle aches and pains. Those patients we refer to as having post-treatment Lyme disease syndrome. So we recognize that condition exists. The fundamental question is, what is the cause of that condition? Is it a persistent infection, or is it a complication of prior infection? And what is the best treatment for it? Is it long-term antibiotics or not? On the first question, we don't know the answer. It's possible that it's either one of those. We do have data on the second question. As I mentioned, a number of placebo-controlled trials which have looked at patients with this post-treatment Lyme disease syndrome and given them various courses of prolonged antibiotics. And the bottom line of those studies is that overall they do not seem to benefit those patients in the long run.
Okay, we've got about 5 more minutes, so we need to to, excuse me, we have about 5 more minutes, so we need to.
Understood. No problem. No, I just have a few more questions. Thank you very much. There are critics who say that one of the reasons why the CDC will not call post-treatment Lyme disease syndrome as chronic Lyme is because at the end of the day, the agency believes that it is in fact curable, that you can be cured of Lyme. There are others that say that the CDC simply doesn't want to admit that someone could have a lifelong illness as a result of a tick bite.
Well, I don't agree with either one of those statements. There's another reason why the term chronic Lyme disease is not favored within the medical community, and that is that there are patients who have untreated Lyme disease and who are chronically infected because it's caused arthritis, and that infection can persist for quite some time. Now, many of those patients will in fact self-cure, but that condition of arthritis has been called chronic Lyme disease as well. So it's really a matter of semantics that I think you're getting into. I certainly don't agree with the notion that Lyme disease could not produce sequelae that may be long-lasting. Even if you look at people with facial palsy, some of them get treated and it resolves entirely, but there may be people who are left with some permanent nerve damage as a result of it that may last their lifetime. Not because they're still infected, but because the nerve was damaged. So I simply disagree with both of those statements.
In terms of insurance, because my understanding is also that the insurance will only cover a specific antibiotic treatment, which only lasts about a month or so. But again, there are people, especially one 12-year-old girl who I spoke with who was infected at the age of 9, who said that she has only seen some sort of normalcy in the wake of being infected with Lyme disease after she has received intravenous medication, intravenous antibiotics, which her insurance won't cover, and we've heard this time and again. Why won't the insurance companies step up to do this? Is it because of all of the misinformation or all of the controversy surrounding this, some of which stems from the CDC's position?
Well, I think that would, why insurance companies do and do not cover things is probably a question to ask for the insurance companies. I think what they may be looking at is the scientific literature and the studies that have been done, which, as I say, patients who get antibiotics improve, but they do not seem to improve substantially faster than or better than patients who got placebo. So that may influence some of why they are choosing to cover or not cover those costs.
Sir, just one last question for you, and then I'll let you add anything that you think that we may have missed that you'd certainly like to touch on. To those patients and those families that will watch this special, those people, 12-year-old girl who has spent now 3 years of her life fighting what she believes is chronic Lyme, to those people who feel as if the medical community has turned their backs on them, that they have been left out in the cold and that they are alone in this fight, to those people who feel as if the government, the country's chief public health agency, should be doing more to help them in their fight. What do you say to them?
Well, I think there are two things to say. One is we are very concerned about patients who are ill, both those patients who have post-treatment Lyme disease syndrome, as well as those patients who may have been misdiagnosed with it. So part of our policies and efforts really are directed at trying to help those patients. There is, in fact, quite a bit being done on treatment and diagnosis of Lyme disease. A lot of it, frankly, is being done by the National Institutes of Health, which specializes more in those issues. CDC is certainly looking at ways that we can try and prevent people from getting infected in the first place, and I think that's really what we can do to try and help turn the tide on this disease.
Sir, if you were bitten by a tick and you knew that you had Lyme disease, what would you do?
Well, I would probably see my healthcare provider, and depending upon the stage of Lyme disease, I would have them evaluate me and treat me appropriately.
And if the IDSA guidelines, based on those tests came back negative for you, would you demand that you were given the ILAD test, or would you demand that that provider continue to push to ensure that you didn't, in fact, have Lyme?
Well, I think it would depend upon the circumstance. As I mentioned, the serologic testing it is a various sensitivity and specificity depending upon the early stages of disease. If I had been ill for months and I was tested for Lyme disease and the test came back negative, I would not insist that my provider treat me for Lyme disease. I would try and figure out what the real cause of my symptoms was so that I could get the appropriate therapy.
Okay, I think that concludes the interview. Anything that you would like to add, anything that you think that our viewers, those who have Lyme, have been cured of Lyme, and those who have not gotten it, anything you want them to know from your perspective?
Well, I think the only things I would add from my perspective, we haven't brought up prevention or a number of the other topics that I think were going to be part of this this interview. But I think it would be worth making sure that patients or their family members or just the general public in Lyme endemic areas know the things they can do to prevent Lyme disease, including using repellent, doing daily tick checks, wearing protective clothing. And there are things people can do in their yard to help reduce the abundance of ticks in their yard, which is where many people become exposed. So that information is available on our webpage and other places, and I think that if we can prevent a lot of these cases, then the issues of people dealing with the long-term manifestations of it will be hopefully reduced as well.